Glaucoma is the leading cause of irreversible blindness and is estimated to affect 60 million people worldwide. This equates to 1 in 50 people over the age of 40 and 1 in 10 people over the age of 75. By the year 2020, it is estimated that there will be almost 80 million people in the world with glaucoma. This group of ocular disorders is characterized by progressive loss of axons in the optic nerve, accompanied by visual field damage. In most cases, damage to the optic nerve is due to irregular intraocular pressure, and patients may not present any symptoms until a very advanced stage. As a result, it is vitally important to start therapy as early as possible and control the progression of the disease. One of the greatest challenges for ophthalmologists is the correct diagnosis and management of glaucoma. Since one of the characteristic changes presented is glaucomatous excavation, or depression of the optic disc, correct diagnosis relies heavily on the images provided by a retinal camera. 3D stereoscopic technology involves retinal photography in both the planar and axial depth direction, so a clinician can inspect the physiological condition of the optic disc using the most realistic visual representation.
The key challenges of monitoring and diagnosing glaucoma is diagnosing the disease at a relatively early stage and reducing the burden of the disease in the community. Instituting appropriate therapy, interacting with the patients in a positive and an anxiety-reducing way. But one of the toughest challenges is monitoring the progression of the disease in a practical and pragmatic way.
Glaucoma generally is a very slowly progressive disease. And so we're looking for very subtle changes in the optic nerve head to try and pick up the disease and pick up progression at its very early stage. Traditionally, we've always relied on visual field tests, but visual fields are very poor in the early stages of the disease. You have to have a very significant retinal ganglion cell death before you may start seeing changes in the visual field. And also, sometimes we see progression based on structural changes within the optic nerve, and sometimes we see changes within the visual field test. So we've got to combine all different modalities in trying to identify those patients who are going to progress and who are at significant risk of vision loss.
Stereophotography is probably the best time-tested method for documenting the appearance of the back of the eye, which itself is a three-dimensional structure. It is helpful in diagnosing glaucoma at the early stages and even in moderate glaucoma. It's helpful in assessing the progression of the disease. It is also helpful in monitoring the disease in the community, and by way of telemedicine or a virtual clinic setup, we can monitor the disease much more effectively. And it's very helpful in opportunistic finding of other related eye conditions at the back of the eye, because the stereophotographic camera gives us a wider angle picture of the back of the eye itself.
I think virtual glaucoma management is going to have an increasing role in the management of glaucoma patients. I think gone are the days where all patients could be seen every single visit by a consultant ophthalmologist. And to be honest, that's not a cost-effective way of running a service. It's not an efficient way of running a service. And most patients will never have any vision problems that will necessitate seeing a consultant ophthalmologist.
So at Moorfields Eye Hospital, we're running 2 pilot schemes. One is a screening service for new glaucoma referrals into the hospital, and one is a stable monitoring service. So the screening service, in that clinic, new patients who are newly referred glaucoma suspect patients who we feel are low-risk patients, so they only have one of the 3 risk factors for developing the disease, they're put into this clinic. And the clinic, the screening clinic, is run by 2 technicians who will take all the data that's needed. So by that I mean their visions, their visual field, Kowa disc photography, slit lamp Goldman intraocular pressure and Van Herrick's. And then after that, the patient leaves. So that patient journey is about 40 to 45 minutes, run by 2 technicians. And then what happens is that the ophthalmologist will remotely or on another day review their data and make a clinical decision. So whether the patient needs to come back for a face-to-face consultation or whether they are safe to be discharged back into the care of their community optometrist.
For the patients in the stable-led service, the stable glaucoma patients, these are patients who we identified as low risk and who only need to be seen either 9-monthly or 12-monthly. And again, they have the whole range of tests, which are again reviewed not on the day, but within a week or two by a consultant ophthalmologist, who then determines whether the patient remains stable and can be followed up again in that same clinic, or if there's any sign of progression, whether they need to be referred back to see a consultant ophthalmologist in person. Nowadays, what we want to try and do is not only provide a safe environment to pick up glaucoma that's progressing, but we also want to give a good patient experience. And patients aren't getting a good patient experience when they're waiting for 3 or 4 hours in the clinic.
The greatest utility of the Kowa 3D camera has been in the performance of virtual clinics. I do virtual clinics once in every 4 clinics. In a normal clinic session, I can see about 15, 17 real patients. Whereas in a virtual clinic, I can examine the records of up to 55 patients and take a decision on them, which is nearly 3 times the number. This is a huge cost saving, and the purchase of the equipment can be justified purely on that cost saving.
The Kowa Nonmyd WX, the world's first 2D, 3D simultaneous stereo retinal camera, is an innovative optical product which pairs cutting-edge technology with intuitive design in order to combat the difficulties of observing and diagnosing sight-threatening conditions such as glaucoma. The Nonmyd WX is a new concept in stereo photography, which captures simultaneous stereoscopic photographs in just one shot. Thanks to its exclusive optical design, combined with a high-resolution digital SLR camera, it offers both standard 2D and superior 3D stereo images. Due to its non-mydriatic capability, the camera can be operated by a trained assistant, meaning that it's not necessary for an ophthalmologist or medical technician to capture the images. New technology allows the software to locate the corresponding point between the left and right images, so the depth can be calculated immediately. The 3 photography modes, normal, small pupil, and stereo, allow the clinician to take retinal images which meet their specific needs. Instant and simultaneous 3D photography is possible in one shot, so stereoscopic images are taken without the camera shifting, and the clinician can view the shape of the optic cup and disc in the highest level of detail. The software enables real 3D viewing with any compatible 3D passive monitor. Alternatively, the clinician can view the stereo images on a 2D monitor using adjustable stereo viewer glasses. The viewing methods can be easily changed in the stereo toolbar. Please pause the movie and put on your 3D color code glasses to view an image taken by the Nonmyd WX retinal camera. The software allows you to easily visualize the glaucoma progression in a time sequence movie. This means you can visualize the physiological progression of the disease at the optic cup. Please remove your 3D glasses now. The toolbar also includes a 3-dimensional optic nerve head reconstruction, allowing the clinician to view the differences between a normal eye and a glaucoma eye. This provides a full picture of the optic disc and retina, therefore allowing the clinician to confidently assess and monitor patients suspected of having glaucoma. Kowa's exclusive optical design also delivers extremely detailed retinal images in a standard 2D image. The integrated 9-point internal fixation target allows for mosaic photography covering a large retinal area. These can be merged automatically or manually in the software. Kowa's optional 3D analysis system offers the clinician various optic disc parameters and detailed analysis reporting for the successful management and monitoring of suspected glaucoma patients. Once you have analysed your images, they can be attached to the patient's record in PDF or JPEG format, compared on-screen with previous patient visits, or printed. All of this can be done outside of consultation time, or even from a remote location, allowing the clinician to virtually manage their patients and make workflow more efficient. Kowa is collaborating with Professor James Morgan and the Open Eyes team led by Moorfields Eye Hospital Foundation Trust. The data from the Nonmyd WX camera will be integrated into their open-source, web-based electronic patient records system for ophthalmology. This innovative system will offer ophthalmologists access to all the information they need about their patient in one place and support Kowa's vision for the Nonmyd WX facilitating virtual management of glaucoma patients. In this section, we will hear from ophthalmologists who have already used the camera in this way.
In our new patient screening service, the Kowa stereo camera is the only imaging device that we have. So all patients, when they come in, they have their visual field test and then straight away their stereo disc photography. But we also take a full field view. We take a picture of the optic disc and the macula, so we get a monoscopic view of the whole fundus. And that's because these patients, they're coming for their first ever appointment. We need a documentation of both.
So we use the Kowa three-dimensional stereoscopic fundus camera as an everyday clinical tool in monitoring the progression or in monitoring glaucomatous patients that we see in our clinic. It is a clinical routine that you take a picture of the optic nerve head every time you see a patient in the glaucoma ward. And if you have a stereoscopic picture, it's even better. And if you have an analyzing tool that helps you monitor the progression a little bit better, using this pixel diversion that the camera has, that gives you an even more accurate impression of how the patient is doing.
The Kowa Nonmyd digital stereo camera is very intuitive to use. It's very easy to pick up. What I would recommend is that before you start using it, familiarise yourself with all the buttons. There's an ability to reduce the flash intensity setting just in case it becomes a source of glare when you're taking an image. There's a button that will adjust the illumination of the fundus if you have sort of different pupil sizes or different amounts of light getting in. So just be aware of where everything is. The beauty about it is that when you take the stereo picture, you get, because it's a simultaneous stereo, you get both images of the two angles to facilitate that stereo view. So what I would recommend is that you make sure that both images are clear. And because it's digital, you can just take it a number of times. You're at liberty to take as many pictures as you need to get it right.
The analysis tool of the Kowa camera is actually a very excellent tool that you should definitely use, because it gives you a more accurate impression of how the optic nerve head is developing, even more accurate than you can see it with your eye. And a good tip that I have there is really using the stereoscopic view and using the stereoscopic point of view to mark the outline or the contour of the optic nerve head. That helps a lot.
I would certainly recommend development of a team where a single person is using the camera constantly so that you get consistently reproducible results. I feel that the Kowa 3D camera has got a fantastic opportunity in Asia and developing world, because these cameras are time-tested. They produce very high-quality stereoscopic pictures which enable us to diagnose the disease at a very early stage. And these cameras can be installed at several village locations across the developing world with the help of governmental, non-governmental agencies that are linked to academic agencies or hospitals locally as well as abroad. And these links have to be forged in some manner. But an effort to promote such a situation would be very, very helpful from my point of view. For the simple reason, it will enable case detection in those people who are at high risk of developing glaucoma. It's probably one of the best ways of detecting glaucoma in the community, rather than using the other investigations like intraocular pressure or visual field, or even new technologies like HRT or OCT, which are often very, very expensive and difficult to take a decision on.
We hope you have enjoyed learning about stereophotography and how the Kowa Nonmyd WX retinal camera uses this technology to help you detect and assess glaucoma more efficiently. For more information on this product or for a quote, please talk to your Kowa representative or visit the Kowa website.